A Glendale man says he took an email from his insurer to mean one thing when it really meant something else.
CBS 5 advocate Dave Cherry joins us now. Dave, this is another reminder to confirm any provider status.
Yeah, that's right, Chris. It's cheaper always to use in-network providers. I've been telling consumers that for years. Call your insurer, always confirm that status before visiting any healthcare practice. Even if your insurer encourages you to visit a specific provider, don't assume they're in-network.
Greg Loper says it was time for his son's annual eye exam. He happened to get this email from his insurer, Blue Cross Blue Shield, touting a special back-to-school offer from a company called Vision Care. Loper made an immediate assumption.
An email like that, I don't even give it a second thought, to be honest. I figure it came from Blue Cross Blue Shield. They were the sender, so it had to be in network.
Loper says Vision Care provided his son great service. They required payment up front and gave Loper a receipt he could submit for reimbursement to Blue Cross Blue Shield.
I called them to find out what the reimbursement policy and procedure was, and that's when they told me that Vision Care is out of network.
There is a disclaimer at the bottom of the email, but Loper says it's not clear. He says he continues to get similar Vision Care offers from Blue Cross. He wonders why his insurer would send him emails touting an out-of-network provider.
My assumption was that it was an in-network provider. Otherwise, why would you send it to me?
Loper says since Vision Care was not in network, instead of a 10% copay, he had to foot the entire $213 bill. He warns others not to assume anything about an insurer email. Confirmation is still needed.
They should always call the insurance company and make sure it's an in-network provider.
Before they head there.
Absolutely.
Now again, that email disclaimer does say this is not insurance, but it is in the fine print. And again, this email is essentially a recommendation from your insurer, so you could see how this could be confusing. Again, these emails are just simply offers for valuable healthcare services that are not covered by your health insurance plan, and we want to make sure that no one is confused by that. Blue Cross Blue Shield, they say they've asked Vision Care to review its disclaimers and make any necessary adjustments, so this point is clear. Chris?
That is weird. You can understand why there would be confusion there. All right. Thank you, Dan.